All right, hey there, thank you for joining us. My name is Chris, owner of VHS Physical Therapy and Chiropractic, as well as
Kristen.
So Kristen and I had a chance to look at one of our taller volleyball players, adult volleyball players. Not one of the, we have some kid ones as well at the other clinic a lot more often, but this guy was complaining of knee pain, actually quite severe. It had a lot to do with jumping and landing. So a lot of the knee pain, which seemed like on the history, very much a tendinosis or tendinopathy type problem, because he'd had it for so long. It wasn't a constant pain. It was definitely intermittent with jumping, landing, high level explosive type activities. So we, had to go through the history. We had to assess the thing deep into the joint first to see if there's anything else going on in there. And then one thing that was interesting was that he wasn't sore necessarily right in the middle of the patellar tendon.
Yeah,
kind of to the medial, to the inside of the patellar tendon, like along the joint line. So, and there were some times where he would it was pretty consistent, but there were times when he'd feel better and worse than others. So they gave us a little clue that maybe something's going on inside the joint. So,
and the passive motion is what got him more aggravated versus, whereas if it was a tendinopathy, then necessarily the passive motion wouldn't change the pain.
Yes, good point. So when thinking about a contractile tissue, or in this case, our initial thought was a contractile dysfunction, meaning muscle tendon, something didn't heal right, and there's a maladaptive healing inside that muscle or tendon structure, which would not affect passively moving the joint, all the way bent or all the way straight. It would only come on with a load, either shortening under load or lengthening under load, like eccentric. So that's actually what hurt him, but it was another giveaway where it was like, wait a minute, you shouldn't have pain with deep flexion passively, or extension passively. So what we ended up testing and what we found to be the most beneficial was repeated extension of the knee. And one key there too was when we did loaded flexion of the knee.
It definitely, our retest was the single leg squat.
That's exactly, our baseline was the single leg squat.
So just show,
so we'll show what that looked like.
So at first he could only go maybe to there.
Yep.
The right leg was way deeper squat.
Yep.
So then after the repeated flexion,
which we did by putting our foot up on a box, or his foot, and we had him really dig deep in there and go way down, really bend it. And then when he tried it again, it was a whole lot worse.
His squat was way more painful, couldn't go any lower.
Which, again, theoretically should not affect a tendon problem that fast. It's only 10 reps. It just was, we were just bending it. It was fairly passive. He was putting a little bit of load through it with his chest, upper body, but it wasn't high explosive loads.
Right.
I don't think it even hurt him while he was doing it, really. It was the after part. So then what we used was an extension and so we want to show how we kind of set that up with the...
I'll do it on my right leg just for the video.
So we used a band instead of the traditional way of
normally people would do it.
We'll pull against it because we want to strengthen the VMO and some of the knee, and that actually would work well for the young lady that we talked about the previous video. But this one...
the weakness part,
This one we wanted the band to assist and get into hyperextension. We didn't care much about the bend or the resistance. I actually wanted the resistance to assist us to get back into like super tight extension. And so after maybe we probably did 20, 30, 40 of those, intermittently, and we'd check every time. It started to increase the depth at which he could single leg squat.
Then he was squatting way, obviously this is the opposite leg of what I just did, but for the video, his hurt knee was definitely, he was squatting way lower by the end of it, and it ended up
with less pain.
Yeah.
So that's just another example of what can come in looking like something, or similar to the other girl that we had that truly did have just some weakness around the knee and the structures that support the hip and everything else, as opposed to more of a deeper joint issue that we're going to really exhaust first. And I think we're going to get quite a bit of result and benefit from that. I think we'll still have to work on a little bit of tendon stuff with him.
Yeah, he definitely has some tendinopathy going on, which is probably a result of the intra-articular issue going on.
So that's we're gonna work on those and combine some things with that. But just another idea of why you need to at least look deeper past the joint and just not on the surface level of take a 5 minute, well, here's what he says hurts.
Anterior
it's probably
knee pain.
this.
Let's do some quad sets, TKE.
Exactly. So that's why we did that, and we'll make some more, educational type things and give you some more information as they, as interesting cases come along. Kristen's going to be doing some more stuff also on our social media platforms, on the Instagram and the Facebook, so we can get some insights of what it is that we do here. Yeah. So, okay, thank you.